Hello, everybody. I am so happy that you made it. Dr. Vyvyane Loh, thank you so much for coming on. This is going to be a fantastic show because you're on it. How about that?
Ah, thank you. I'm looking forward to it, Teresa.
This is going to be great. So, listen, all of you guys who are on, logging on, listening to the replay, you made it. It is Monday. It is 8:30. It is time for Conversations with Teresa. Thank you so much for being here. I said it earlier, ridiculously excited to have Dr. Vyvyane Loh on here. She is just a walking encyclopedia of knowledgeable things that you're just like, oh, like I wouldn't even have thought of that. And then on top of that, she's a doctor, like legit. It's not just like random stuff. Like it's such great stuff, great stuff. So, Dr. Loh, I understand that you are internal medicine and obesity medicine. That's what you focus on. I understand that you also have a practice of well, you're going to talk about it a little bit. I'm going to let you talk about it, but let us know what it is that you do besides just being awesome at what you're.
Thank you. So, like you said, I am board certified in internal medicine and obesity medicine. And my actual focus is quite simply reversing disease, okay? Helping people to reverse their disease. And, this might not be so obvious to people, but you think about it, the entire healthcare and medical system that we have is really focused and prioritized towards sick care. Right. And you think about the business model too, nobody gets paid till you get sick. So now, basically, if that's the business model, then really it's to the advantage of the system to keep people sick, right? And yet we know that most chronic diseases are reversible. Most chronic diseases are reversible. Things like diabetes, high blood pressure, even some forms of kidney disease, heart disease, these things are reversible.
Wow.
And yet we never talk about really reversing those diseases. So if you got sick, you got some kind of diagnosis like diabetes, pre-diabetes, these things are very common. I just spoke to someone recently, and she was told by her physician that she had pre-diabetes. And it was sort of, she was very, very, down about it. And it was because it was presented as something that was genetic and that, eventually it's going to progress and then you'll get diabetes and so forth. And that's really not true, especially in the pre-diabetes stage. It's completely reversible. Most type 2 diabetes is really reversible, right? I've taken plenty of people off insulin, off their medications, right? And yet we never talk about this. We never talk about reversing high blood pressure and heart disease.
Right.
So you just we're really not in healthcare. We're really in sick care. Right? You think about it. So when people ask what I do, I say I try to do real healthcare, and I do that by reversing or preventing chronic disease.
Right. No, well, that makes so much sense because that's what I guess that's exactly what people are thinking about. Like, so I know people who have have said they had pre-diabetes or diabetes, and it's just like, okay, well, I got it. I guess I'm going to have it for the rest of my life. Like, there's not a let me change this. Let me do. It's just I've got it, so it's done.
Yeah, so, and that's so not true. And it's the same for, like I said, for things like blood pressure and so forth, right? It's all often presented to the patient as, oh, well, it's kind of inevitable. And then you go through this, it's almost like a ladder of progression. So you start down here and, maybe we'll start off with some medication. Then we'll just keep adding medications. We'll increase the dose, we'll add medications. And we get to a point where, oh, there's not a whole lot more we can do, right? We see this with kidney disease. We see this with many kinds of diseases.
Wow.
It's very sad to me because most people are, the fact that you're surprised by this, right?
Totally surprised.
Yeah, and most people I talk to are very surprised. And if you think about it, 60% of Americans have at least one chronic disease. Okay, 60%, right? And if we look
Wow.
at in older adults,
Mhm.
more than half of the older adult population has 3 chronic diseases or more. Okay.
So when you talk about chronic diseases, and we talked about this a little bit over the weekend, I think we were just chatting, and I was just like, I don't have any chronic diseases. You're like, you just told me 3. And I was like, really? I did? So you were talking about migraines, right?
Yeah, yeah,
And then we talked about sickle cell trait, I
yeah.
think. Oh, look at that little thing on there. And I
And you
forget
have,
what I
I
had
think,
both of those, right?
yeah.
And
Now the trait is genetic. Okay, the
okay.
trait is genetic, but I think if I'm very careful. I know what we discussed, so am I allowed to say it?
Oh
I
yeah,
don't want to.
absolutely,
Yeah.
absolutely.
Okay. So, because you mentioned you had anemia,
That's what it was. That's
right?
right.
And that to some extent we can definitely, through diet and how we manage our lifestyle, we can definitely kind of help you get more iron in your body so that you don't
Mhm.
need to get to a point where you get transfusions of iron and so forth.
Well, look at that.
Yep.
So, literally, my entire life, since I remember making my own doctor's appointments by the time I was like 14 or 15 years old. So, since then, I have been told that I have anemia. Not let's reverse it, let's help it. Here's some pills that I couldn't tolerate,
Right.
right? But that's it. I've never been told that I
I
can
bet
reverse that.
I bet you weren't told how to take those pills for better absorption. I bet you weren't told options for different types of forms of iron, right? I mean, it can go on, right?
Right.
So, and the same with migraine. If you've had migraine for a while,
Mhm.
right now, really, most people with migraines really should be making sure they take enough magnesium. They, should make sure that their vitamin D status is okay. And most people living like us in the Northeast, we're vitamin D deficient. Okay.
Right.
You just
Right.
cannot get enough sun. So, if we're starting off at that point where we also have nutrient deficiencies that interfere with the way our body functions, then yeah, clearly we're not going to be functioning optimally. Right.
Right.
So
Right.
then again, we think that these things are either genetic, and so they're somewhat inevitable,
Mhm.
or, and this is the part I really hate, it's part of getting old. You're just getting old. It's aging,
Okay.
right? And I grew up, I grew up in Singapore, so I grew up in Asia, and my experience of people aging was very different from what I saw here. Because growing up, I saw 80, 90-year-olds running up and down the stairs, carrying their grandkids on their shoulders,
Okay.
doing the shopping on their bikes, literally like climbing trees.
Wow.
Okay. Then I come here and I see some 6-year-olds with walkers who, broken their hip or something. And I was like, wow, okay. I had actually, to be very honest, and I came here a long time ago, but I'd never seen a walker until I got here. I didn't quite know.
Wow.
Yeah, I didn't know what they were for.
Oh my
So
gosh.
yeah, my
Look at that.
experience of aging is very different. And I think that we have very low standards for aging in this country. Just really poor standards
Wow.
for aging, right? And
Right.
we have a very low standard for the definition of health, Teresa. Okay?
Okay.
Because in the medical world, what is health? Oh, well, mostly is defined as absence of disease. Okay?
Okay.
And that is like the lowest of the low, lowest bar you could ever imagine. Because it's like, well, I can't find anything in your blood or maybe in your vital signs or whatever. So right now I can't put a disease name on it. So I guess you're healthy. That's
Mm.
really what we're saying, right?
Wow.
Because there's no
Wow.
other, I don't see any other definition of health, at least not in the medical world, definitely not in the medical curriculum. Okay. So
Look
now
at
if
that.
that's what we start with, yeah,
Mm-hmm.
then, no wonder we have such poor health in this country because we
Right,
don't even know
right,
what it is. So, you're shooting in the dark, really. Like, what's the target? I don't know, you know,
right.
and
And
it
I
could
would
be anywhere.
imagine even your example that you said, growing up in Singapore, what you saw, right? So very different, obviously, than what I've seen. So that is what I almost expect, right?
Yes,
Like
that's
it's
right.
just like, oh, okay, I'm gonna start walking slower. I'm not gonna have enough energy. I'm not going to be able to lift or stoop down, or I'm gonna get the gout, or
Right, right. And
it's
these
these
are
things.
all preventable, right? And interesting
Wow.
what you said about walking slower. Um,
Mm-hmm.
so your gait speed as you age, that means how fast you walk, is correlated to how your brain is functioning, right?
Stop it.
So, yes, so back in the old days, when we would do a screen for dementia, it's kind of like you go to your doctor and you do a screen to make sure that maybe your brain's still functioning, your mind's
Right.
all there, you maybe don't have huge deficits in memory and things like that. So they
Mm-hmm.
used to just do what we call the mini mental health screen, and they'd ask
Okay.
you things like, who's the president, what year is it, and then they'll say 3 words, and then later they'll ask you to remember it, that kind of stuff,
Right,
right?
right.
Well, nowadays people are going towards, guess what? Looking at how you move. How fast are
Okay.
you walking, right? What's
Okay.
your balance like? And that's going to tell us more about, the quality of your brain and your brain function than any of
Ah.
those silly tests, right?
As you're saying that, I remember like every time I go to the doctor now, they always ask me, "Have you fallen?" I don't remember like the time frame in the last 6 months or the last month or something like that. But I'm like, why do you keep asking me if I fell? Like, I know I didn't fall.
Yeah,
But
because they
but
want to
this,
know about your
yeah,
balance.
yeah.
And, as you continue to age, they should be looking at how fast you're walking, right?
Ah,
And so movement is definitely related to brain health. That's
I
one.
gotta write this
But
down.
the second thing is, now the quality of your movement is also dependent on your muscle function, the health of your bones, right?
Mm-hmm.
And if you're losing muscle, which a lot of people don't realize they're doing as they age, right? And they become more and more frail as a
Right.
result, losing muscle and bone and accumulating more fat. So their body composition is changing as they're aging. So now you have less muscle and you also have poorer quality of muscle. So the muscle is weaker, it doesn't function as well. Now
Okay.
that's directly tied to brain function. Yeah.
Wow.
Yeah. And, we never address that. Now, so here's the best part. So your doctor might kind of make the link that, oh, your gait, you're not walking very fast, right? And this might tell us this brain is not functioning very well. But what are we going to do about it? I don't know. We just keep watching it, right? And I'm like, okay, excuse me. What's the
Wow.
point of doing this if we're not going to intervene, if not going to have a plan to help the patient get better? Because there are many things we can do to improve the quality of your movement, your muscle strength, right? All of that
Right, right.
never gets discussed. And by the
No,
way,
no.
never gets taught. It's not taught in medical school. It's not taught in residency, right? Almost never mentioned, really, in the medical
Okay.
world. How do we improve that? How do we help people age better,
Right,
right?
right.
How do we help them improve and increase their health span? Okay. Like, I know we think about lifespan, but maybe it's more important to think about health span, which is basically that for however long you live, you're healthy and vibrant. I
Right.
think, we all want to go, at least I want to go like, go like kadunk, right? La 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 kadunk. Like, isn't that the best? I mean, who wants to
Listen,
go?
I am of the
Right,
thought that if there is a meteor coming to the earth, don't tell me. Like,
right.
let me just let it
Here
be
I
done.
am, and then I won't know. Right, right. We all want the kadunk exit.
Right,
Nobody
right.
wants the lingering,
Exactly,
for years,
exactly.
suffering and not being able to do the things you want to do. And I can't tell
Right.
you how many people tell me that they're looking forward to retirement. So I always ask people, including doctors. I was at a conference recently, last few months, and I was sitting next to a doctor at the conference, and I asked him, so what do you do in your free time? And he couldn't think of anything that he did. He said, I think I just work and sleep. I said, oh, so you just work and sleep, and then one day you'll be dead, and that was your whole life.
Oh,
He's like,
wow.
and he was like,
Did you say that to him?
yeah, I did, because it's the truth, right? But the thing is, and then he said, well, now I better think of something to do. He says, now that you made me think, right? So my patients come to me, and I hear this so often, right? Oh, I can't wait for retirement. Oh, what are you going to do when you retire? Oh, I want to travel. I was like, well, okay. But if you're sick, that's not likely to happen. So, for example,
Right.
someone with declining kidney function,
Okay.
kidneys are not good. So, okay, you retire. Well, what if by then you need dialysis? You're not going anywhere. You can't, because your
Right.
dialysis is 2 to 3 times a week. You can't go anywhere, right? And
Wow.
people don't tell you that, by the time you go to dialysis, you feel awful. You feel awful. You feel like crap on the days that you have dialysis. On the days you don't have dialysis, you also feel like crap, right? So now it's okay, you feel like crap every day. You can't do
Right.
anything, right?
Right.
You're limited in what you eat. And, especially as you age, once you're on dialysis, it basically within 3 to 5 years, you're dead for a
Oh
lot of
gosh.
people. Or you got to go to a kidney transplant if you
Right.
find
Right.
one, right? So
That's
I
another
think,
one.
and then again,
Right.
as you lose muscle mass and as you're frail, your chances of surviving and doing well after a kidney transplant are low, right? So
Wow.
we don't prioritize that, and we think that we're going to retire and do all these wonderful things. And I'm like, well, here's a thought for you. I always say this to my patients: like everything that you will ever experience in this life, every joy, every moment of grief and sorrow,
Yep.
every experience you will ever have in this life is through this one vehicle, this body. All right. And the quality of your vehicle is going to determine the quality of your ride.
Look at that.
Right. And so, yeah, you could ride in a beat up car, or you could ride in, a well maintained, machine. Right. But the
Mm-hmm. Mm-hmm.
quality of your life, the quality of all your experiences, the quality of your ride through and your journey through this life is
I love
is
that.
really directly related to the quality of the vehicle. And this is the one vehicle you have to experience every moment, everything you'll ever experience in this life.
I love that. And that makes so much sense of why we should
That's right.
be taking care of our body and in our mind and just everything around it, the environment, what we put inside of us, and
Absolutely.
our mouth, what we see, what we hear,
That's
what
right.
we experience, all of those things are going to contribute
You know,
in so many ways.
I did something really stupid this past Saturday.
I can't imagine.
By mistake, by mistake, I put diesel in my car engine.
Ooh.
And my car, basically, I made it out of the gas station, and that was it. It just stopped and died. And it was a long ordeal, but I finally got it to an amazing mechanic who drained and flushed all the lines. And my car's fine right now. Okay, it's good.
Okay, good.
But the point was that car just did not run on diesel. Okay. And we're already, all of us, who have vehicles that run on gas, we're horrified at the thought of putting, now anyone I told about this went, right? They had
Yeah.
this moment and yet we don't think about that when we put, all the junk in our system,
No, not at
right?
all.
We care more about what we put in our car than what we put in this one body that
Mm.
you will ride through life with,
Oof. Wow.
right? It's kind of bizarre. You would not put one drop of diesel in your car,
No.
but we're okay, kind of filling this body, this one body, throughout your lifespan with whatever junk is out there, right? And we're not going to, do the maintenance that we need. So you
Yeah.
take your car in, it needs the oil change and all that, but we're not we'll cut some sleep. We'll sneak a few hours off of sleep, for example, right?
Mm-hmm.
We don't prioritize our mental health. We don't prioritize, like, how do we care for ourselves in moments of stress? How do we, kind of optimize our nutrition, right?
Mm-hmm.
We ask those things when we are thinking about our cars, for example. How do we
Right, right.
maintain the car and keep it in good condition? But
Absolutely.
we don't have the same concern, not directly, I think, for our bodies.
I think we don't take it into consideration. And just like you said, like I don't know why I know not to put diesel fuel in my car, but I do know that it's bad.
Right.
But the first 10 things that you named off when we started, I didn't know. I didn't
Right.
know those
Yeah.
things,
Yeah.
and such a harsh reality that we don't know about this thing that we've been given, this, like you said, this one body, this one vehicle, that we're
Right.
not taught it. We're not, there's so much to learn about it, but there's so little that we understand about it. And so, given that information, right, that realization, what are some of the things that we should be concerned about in our everyday, like maybe some things that are easily ignored, like you said, you know um I don't my anemia,
Yeah.
right? you know
Nutrition is a big one, right?
hmm
Because we all know that when you take medications, pills, whatever, they have an effect on you.
right.
We all know that, right? You take your blood pressure pill, your blood pressure goes down. Okay, but somehow we ignore the fact that what we eat every day after day, through our entire lifespan, has an effect on our bodies. Somehow we're just kind of separated what we eat from how it impacts our bodies. But if you
mm
take a little pill, well, within an hour, it's going to have an effect. But the food doesn't have any. I'm like, why? Right? What's it?
mm
And we eat more of the food, and we've eaten it our whole lifespan,
right, right.
right? So your nutrition, has direct impact on your health, right? And we don't focus on it, but don't be harsh on yourselves. Let me tell you that we don't learn about nutrition in medical school,
Oh,
right? And
oh,
when I tell people this, they're all like, yeah, no, I had 0 hours. And now in the best
wow.
case scenario, some schools have 1 hour out of 4 years, right?
Ouch.
And we don't do anything on exercise. We don't do anything on sleep, right? So now you're wondering, oh, we should be. I'm like, oh, I feel bad. We haven't. No, don't feel bad, because your doctors don't even think about it.
Wow.
Remember, it's sick care, and nobody gets paid till you get sick. So really, we don't care. La 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 la. Sick? Okay, you can start this pill. You can do this. We'll build that. We'll build this. You'll have this visit, that visit, right? But prior to that, hey, nobody cares. You're on your own, right?
And it is true, you're right. Oh,
Right.
wow.
So nutrition. And we talked about movement. We talked about
hmm
how the way you move, the quality of your movement, is directly related to brain health. So that means we should be taking care of the entire movement system, which includes our muscles, our nerves, right? So we should be conditioning them through exercise. But again, we don't teach that in med school. right? And we should be preserving our muscle as we age, because most people lose muscle as they age. We should be preserving this, but they don't talk to you about that either. You know, when you lose muscle, it's a very significant predictor of death in healthy older adults. So
Hmm.
people with less muscle will have more complications from anything, a cold, a surgery, whatever. Anything
Really?
will have more complications and a higher risk for death from anything, what they call all cause mortality. That means from anything. Okay. So,
Wait.
yeah,
Just to be clear, the loss of muscle
yes,
increases my chance of all these other things going
yes,
bad.
yes. And there's so many studies now from the, did you hear anyone do anything about it? No. Right? Okay. So we talked about nutrition, we talked about exercise and sleep. Okay.
Sleep.
Because sleep is not you being unconscious and nothing happening. Sleep for your body is a really active process. You know, if you go to when you go to sleep, it's like, okay, nothing's happening. Your body is like hard at work repairing the damage that has occurred and accumulated through the day, getting rid of toxins that have accumulated in your brain. So, when you lack
What?
sleep, we actually accumulate these toxic proteins in our brain that are associated with dementia, like Alzheimer's. Okay. And that cleaning of the brain
You are
only
blowing my mind.
happens during sleep. It doesn't happen with you like sitting down, closing your eyes, and just resting for a moment. Good try, but it's not going to work. It has to be during sleep. And we all need about 8 hours of sleep, okay, every day. But most people get closer to 6 hours.
Right.
Yeah. And as you sleep deprived, your brain gets deprived too. And it gets accumulation of toxic proteins. Okay. And this can lead to dementia. All right. I just laid it out very simply. But
You
there's
just
so
laid
many.
a lot of stuff out. Oh my, like I'm sitting here like, I gotta go to bed. We gotta get off this.
Yeah.
No, but
No. It's
seriously,
it's so true. Right?
okay, I'm just gonna throw myself out there again. Another thing that I have is sleep apnea,
Okay. All right.
right?
Here's something that a lot of people don't realize. Sleep apnea is really one of the primary reasons that people get high blood pressure and don't even know it.
Come on.
So if you don't treat the sleep apnea, you will never you should be. Most people who have untreated sleep apnea, I always go, so you're on 3 medications by now for your high blood pressure and your blood pressure is still high. How'd you know that, doc? I'm like, because you did not treat the sleep apnea. And so, what happens when you have sleep apnea is apnea means you stop breathing.
Right.
So, during your sleep, you stop breathing so many times. And when you do that, it's an emergency for your body. So, your body says, oh, wake up, we're going to die. If you stop breathing, you don't get enough oxygen, right? So, it wakes you up. So, people with sleep apnea wake up so many times at night that they don't really sleep. So
Right.
I've had people wake up 800 times when they did the sleep study in one night, and they are
Yep.
exhausted. And this
Mm-hmm.
brain is accumulating toxins. But the other thing it's doing is it's deprived of oxygen through the night. It keeps doing that. And this is a huge stress on your heart. So your heart rate goes up and your blood pressure goes up because it's a stress. And your body is working
Wow.
extra hard. And if you don't, so I had a woman, and because she looked very thin, her doctor said, oh, you're fine. She's on 3 meds, for high blood pressure. I said, you need a sleep study. And she went to her doctor who said, you don't need a sleep study. I don't know. And so I said, you got to fight for this because this is your blood pressure, right? And you've had that high blood pressure for years. You're on 3 meds. Nothing's happening. Get a sleep study. She got a sleep study. And the staff at the study center, the next morning, they didn't let her drive home. They said, "Oh no, honey, we're calling an Uber for you." That was scary. We've never seen such a bad study. Okay, they put her. I mean, basically, they gave her the CPAP. She started using it. Went off all her high blood pressure medications. Now,
What?
most people with untreated sleep apnea, either they never found out they had sleep apnea or they
Yep.
did the test but didn't use the CPAP machine. That
Yep.
leads to high blood pressure. That high blood pressure is the number one reason for an irregular heart condition called atrial fibrillation, right? It causes your heart to become irregular in its beating, and that's abnormal. And that will predispose you to strokes later on in life, heart failure. That's not a good thing when you have atrial fibrillation. But if
Oh
you're
my
not going
gosh.
to treat your sleep apnea with CPAP, yeah, we're not going to like be protecting your brain. Brain is going, we're not protecting your heart. You'll be having high blood pressure. You're stressing out your kidneys, right? You could get a stroke.
What?
Right? But no one tells you this.
No,
So
listen.
let's give
No
you another pill.
one. Okay. My true confession, and we're about out of time, is that I don't always use my CPAP
Gotta use it.
because I'm aggravated. I'm like, oh, this thing, whatever,
Right.
And
Right.
I went years without using it, and my niece recently was like, come on, you got it. I'm like, okay, I'm gonna do it. And it is. I sleep better, I sleep longer, like, all of this stuff. But
Use your CPAP and
oh yeah,
and most people hate it, love it. So it's always hate for a few weeks, and then like, I love this thing. I
it's
won't go
so much
anywhere
better.
without. So you
Yeah.
just got to get over the hump because most people need. I always give about a month for people to get, and this is something they don't tell the patient. They're like, use this thing. And I'm like, listen, you're gonna hate it. When I tell them, you're gonna hate it for a few weeks. So you got to stick with it. At least then, they know and they keep going. And then they get through that hump and then they get to this place where they really love and depend on it and they should keep using it.
Well, listen, I am a believer now. Thank you very much. I will be
Yes.
using CPAP all the time, and I'm sure that anyone who's listening who has sleep apnea, you'll be using yours too.
Yeah.
Wow, and so many other
Protect those
things.
brain cells.
I again had no idea. So
Now, let me just say one thing about the brain
yes,
cells, right? So, we all hear like sometimes babies during the delivery process, maybe the cord gets wrapped around their neck. For some reason, they're deprived of oxygen, right?
right,
That's
right.
called an anoxic brain injury. Okay. So these babies are deprived of oxygen, come out blue, whatever, they get resuscitated. Okay, it's great. Now, you think about this, a baby's brain is still developing from birth all the way till the 20s. For a guy, 25 years old, for a woman, maybe about 20 years old. Brain is developing, right? And so there's still a lot of change and shift. And yet, even in that scenario, which is the best case scenario, because there's still a lot of room for the brain to repair and develop, right? You don't recover from anoxic brain injury, right? You don't recover from death of brain cells from lack of oxygen. Okay? So everyone out there, if you are going to bed with sleep apnea, not putting on your CPAP, that's what you're doing. You're killing brain cells. Wow. And if you got a lot to spare, good for you. But I say keep.
I'm gonna keep all mine. I think I'm gonna go for that. Oh my gosh, this is So I'm blown away.
Because it doesn't come back, is what I mean to say.
But
the
that's
ones
the
that
thing.
die don't come back. Yeah.
That is, it's very sobering, but it's so good. Like, information is so needed. It is so powerful, so needed. And if we had more of it, like, you at least get a chance to make wise decisions. Some people may still look at this and be like, I'm still not using that machine, but it's not from a lack of knowledge. Okay, you want to be stubborn? Okay, knock yourself out. But you know what I mean? But I didn't know any of that.
Your risk for dementia, right, is very high with untreated sleep apnea. Most people,
crazy.
Have a high risk for dementia early in life.
Early.
Yeah. Because you're losing those brain cells.
Well, now it makes sense. Now it makes sense. So, okay. So listen, we are out of time, but
I better come back.
Yes. I was about to say, I was smart enough to ask you to come back next week as well, because I knew this conversation was going to be so rich and so just full of stuff. And I really wanted to give our audience a chance to be able to think about some questions that you may have. Some, is this reversible? What
Right.
should I be asking my doctor about? What should I be concerned about? Like, you don't want to call your doctor on everything, but maybe
Well,
we do.
most things that are really, really important in preserving health, reversing disease, unfortunately, they don't teach that. And so most doctors are unaware. I told you, they don't know nutrition, they don't know exercise, they know very little about sleep. And these
Okay.
are the things that are vital to our health, right? It's
Right.
kind of sad.
So I'm gonna ask you tonight, and then we're gonna put it on the website, and then I'll ask you again next week. How can someone get in touch with you so that they can get some of this knowledge and really understand their body? I mean, again, we'll have the podcast next week. We'll be able to answer some questions, but definitely not all. Where's a place that we can come to find
So
out some of
they
these
can go
answers?
to tulaversity.com, and that's TULAVERSITY.com. So it's Tulaversity, and the versity kind of is like, hinting at university, because I really want to focus on education and giving people the knowledge so they can take care of themselves better. So they go to tulaversity.com. What they can do is sign up for a meeting with me, like on Zoom.
Okay.
And this is an opportunity for people to ask me whatever questions, right? And because I do offer a health coaching program to help people learn the things that are necessary for them to be healthy: nutrition, sleep, exercise, right? But a lot of times people want to know, Dr. Loh, can you reverse this? Can I kind of get rid of my medications in the
Right.
long term? So I make it available that they can schedule a free, kind of I call it an orientation, but an information session.
Okay.
And, we can chat a little bit about some of their health concerns and what we could do together.
I love it. Thank you so much. And then shameless plug, you and I are going to get together in April, right? And
Absolutely.
we have a program that we have called Intentionally You. We want to be mindful of our bodies, our mindset,
Yep.
and we want to step into something where things aren't just happening to us like haphazardly. We want to be intentional about the things, like I said, the things we put in our minds and our bodies. And we're going to be able to get together and talk about those things and really be able to just uncover or lay bare, give people information for them to be able to have to arm themselves just to be better in their lives, but to be intentional. So I am so looking forward to that. That is going to be Sunday, April 7th. You guys hold out. We're going to have information very soon on our websites and in social media, Eventbrite. It'll be all over the place. But you want to come to this because this is some fantastic information. We had a half hour. We're going to have a few hours together, and I am super, super excited that we get a chance to partner up. So Intentionally You.
Intentionally You, and we go back to that analogy of the one vehicle that's taking you through life, right? So you got to take care of the vehicle, but
That's right.
Who's the driver, right? And so the mindset, setting the spirit right, making sure that the driver knows where you're going, right? Setting that intention, because again, you're going on this journey and you're going to need not only the vehicle, you need the driver too.
That's right. That's right. So stay tuned. Grab a friend, grab 3 friends. It's going to be amazing. That's Dr. Right. Loh, I'm about to go use my CPAP machine. And
I did my job.
You did good. I didn't even know that was coming. I'm like, oh, I love it. I love it. But we look forward to having you back next week. Again, viewers, listeners, please think about some questions that you may have, some things that you may want to ask, some things that you are always curious. Should I be asking my doctor? Should I be concerned about this? Can I reverse this? What
Right.
should I be doing about this?
Right.
And she's offering her free time. Oh my gosh, at least a solid half hour to be
Yep.
able to answer some of these questions. And like, didn't I tell you she's like a walking encyclopedia?
Yes, there
Absolutely
we go.
amazing.
Yay.
We're super excited. So we look forward to seeing you next week. Enjoy your week. Happy Monday, everybody. Dr. Loh, thanks so much for coming.
I had so much fun, Teresa. Thank you.
Yay. Good stuff. Good stuff.
Yes,
We'll do it again next week.
that's right.
All right, everyone. Have a great night.
Bye.
Bye.